Good evening and welcome. You're watching the 8 o'clock news and Sonal Mehrotra Kapoor. Let's dive into the headlines now. Over 1,000 deaths, first time in 6 months. We've gone from 77 to over 1,000 deaths in just 5 weeks. Overall cases in the past 24 hours, more than Brazil and US put jointly. As deaths rise, pressure on crematoriums, graveyards as well, as families are forced to wait for hours just to perform the last rites. Diggers being called at graveyards to handle this increased demand. And in Madhya Pradesh, oxygen running out. An official who blames the death and oxygen crisis is sacked. Relief in sight for queues for remdesivir at least. After denying shortages, centre steps in to amplify production. After the meeting with the Prime Minister, relief for students of CBSE, Class 10th board examinations cancelled, 12th postponed. A review will happen now on the 1st of July. And lockdown like curbs in Maharashtra from today. What is it looking like? We bring you a ground report. But despite all those numbers and deaths, look at those pictures from Kumbh as lakhs continue to get together. Officials now even denying that it is any sort of a spook spreading event. Centre's U-turn says can't open Nizamuddin Markaz after initially giving it a go-ahead. Cases on the rise across the country. Bihar, 2-week cases up by over 1,000%. No different from what's happening in UP, where the Chief Minister Yogi Adityanath and the former Chief Minister Akhilesh both have tested positive. And all this while muted celebrations amid a raging pandemic. Let's begin with the numbers now. A new day, a new peak in the country. In the last 24 hours, over 1,84,000 cases in India. That is, if you look at a world picture, more than Brazil and United States actually put together. In fact, it's not just the cases, the deaths, over 1,000, first time in 6 months as well. But it's not just the number. We have gone from 77 deaths to over 1,000 deaths in just a matter of 5 weeks. That's just about a month and a little more than that. And if you thought the virus is spreading and infecting more people but not taking as many lives, think again. NDTV reporters traveled to various hospitals and crematoriums and graveyards. And what we found? That in queues, people are standing outside hospital for beds. Families have to wait for hours, 6 to 7 hours at times, even to perform the last rites. Diggers called in as graveyards simply cannot handle the increased demand.
Families waiting for hours for the final rites of their loved ones at crematoriums. One of Delhi's biggest graveyard running out of space. India recorded over 1,000 deaths in the last 24 hours, the highest since mid-October. At Delhi's biggest crematorium, Nigambodh Ghat, the number of cremations have gone up from 15 per day to over 30. Delhi recorded 81 deaths yesterday, highest since early December. 27-year-old Gautam, who lost his grandfather to COVID last night, has been waiting since 8:30 a.m. But even after 5 hours, the last rites have not been done.
यहाँ सुबह 8 साढ़े 8 बजे से है और अभी 1 बजने को है, कोई सुनवाई नहीं है और एक एम्बुलेंस में 3 पेशेंट आए हुए हैं और एम्बुलेंस भी प्राइवेट है.
At Delhi's biggest graveyard near ITO, The JCB is constantly digging more graves and space is running out.
ऐसा है जैसे 4 तारीख से शुरुआत हुई थी, तो शुरुआत में तो ये था कि 2-3 हो रही थी, लेकिन अब 4-5 दिन से तो ये हो गया है कि 17, 15, 16 ऐसे डेली आ रही हैं।
अच्छा
है तकरीबन अभी तो 100 तकरीबन कर देंगे जितनी जगह है हमारे पास।
100 की बची है जगह बस।
हाँ जी, उसके बाद बढ़वाना पड़ेगा। जो कोविड ब्लॉक है वो तकरीबन भर ही जाएगा
अगले 10 दिन में।
हाँ, अगले 10 दिन में। उसके लिए फिर कमेटी से आगे बात करके बढ़ाएंगे।
Mortality is going up. This is because probably of late reporting to the hospital, और बहुत सारे चीज़ लोग मिस कर रहे हैं सिम्टम्स को। कोई अगर बुखार घर पे हो रहा है रिपोर्ट नहीं कर रहा है, and they are coming to the hospital at the final stage.
But many are queuing up at hospitals, say there is a shortage of hospital beds.
तो सुबह से हम चक्कर काट रहे हैं। सेंट स्टीफन हॉस्पिटल में मैं इमरजेंसी करवाया उधर, वहाँ कोई इलाज करवा दिया, फर्स्ट एड करवा दिया, पर तो बेड नहीं मिला था। तो ऐप के थ्रू सारा ट्राई कर रहे थे, सारी जगह में कोई सबसे पहले फ़ोन कोई नहीं उठा रहा। ऐप में पता करने के लिए बोल रहे हैं, ऐप में कोई दिखता नहीं है। हम तो एम्बुलेंस में लेके कितना चक्कर काटते रहेंगे।
Currently, 85% of Delhi's ICU beds with ventilators and 88% ICU beds without ventilators are occupied.
Throughout the pandemic, the Indian government has emphasized how our nation has been better at dealing with COVID because our deaths have been low. But with the second wave, the reality is changing, and it is evident not just with the numbers going up over 1,000 within the last 24 hours, but also through the scenes at crematoriums.
In New Delhi with Saurabh Shukla and camera person Sushil Rathi, this is Kirti Dwivedi for NDTV.
And it's not just Delhi. In Raipur, Chhattisgarh, bodies of patients who could not survive COVID are being dumped in trucks and carried to crematoriums as ambulances have run out.
हम इस वक्त मौजूद हैं रायपुर के सबसे बड़े भीमराव अंबेडकर सरकारी अस्पताल में, जहां पर जो कोविड से जिन लोगों की मौत हुई है उनके शवों को ट्रक पे ले जाया जा रहा है। एक बार फिर से तस्वीर देखिए, इस ट्रक पे शवों को ले जाया जा रहा है और यहाँ पर कुछ लोग भी हैं, उनसे बातचीत भी करने का प्रयास करेंगे कि क्या स्थिति है और इन शवों को ट्रक पर ले जाया जा रहा है। इस ट्रक के अंदर जिन लोगों की मौत हुई है कोविड से, उन शवों को ट्रक के माध्यम से अंतिम संस्कार के लिए ले जाया जा रहा है। आलम यह है कि सरकार इन्हें एम्बुलेंस भी नहीं मुहैया करा पा रही है। लगातार कोरोना वायरस से लोगों की मौत हो रही है और दिक्कत यहाँ पर हो रही है कि एम्बुलेंस भी नहीं है। क्या नाम है सर आपका?
मेरा नाम योगेश यादव है।
सर यहाँ पर कितनी की संख्या में बॉडियों को ट्रक पे रखा जा रहा है?
नहीं, गाड़ी कमी होने के कारण सभी को एक ही जगह जाना, इसलिए रखा जा रहा है।
किस चीज में लोड किया गया है बॉडियों को?
तो देख रहे हो ना भैया।
किस चीज में है? कितनी की बॉडी होगी अंदर, कितने की संख्या में बॉडी होगी?
7-8 बॉडी है।
7-8 बॉडी। छत्तीसगढ़ में लगातार कोरोना वायरस के मामले आ रहे हैं और लगातार कोविड की वजह से मौत हो रही है और किस तरह से यहाँ पर शवों को वाहन में ले जाया जा रहा है। स्थिति यह है कि इनके शव को ले जाने के लिए एम्बुलेंस भी नहीं है, इसलिए इन्हें ट्रक के माध्यम से अंतिम संस्कार के लिए शवों को ले जाया जा रहा है।
Just a sign of how desperate things are really getting across the country, and it is indeed across the country. Let's look at some other states now, states which don't necessarily have the highest numbers so far, but the highest spike at least for the moment. Bihar, cases are up by over 1,000% in 2 weeks. Uttar Pradesh, pretty much the same at 940%. Jharkhand, 670%. Assam, 495. Delhi, 455. Maharashtra, 75% only. That means that there is some good sign over there in Maharashtra where the spike at least is not going up exponentially. And talking about Bihar, a retired soldier there suffering from COVID died without any treatment at a hospital as the hospital authorities were busy, guess what, preparing for the visit of a state health minister. Vinod Singh died in a vehicle. He was brought into the Nalanda Medical College and Hospital, and family claims authorities did not admit him despite their repeated requests. They were simply busy with Mantri ji.
आए थे 1.5 घंटा पहले, पापा बहुत सीरियस में थे। हम बोले भी कि पापा को अंदर एडमिट कर दीजिए, उसके बाद जो करना, तो धूप में छोड़ दिए पापा को। कोरोना पॉजिटिव थे, सांस लेने में प्रॉब्लम था।
हर बेहतर स्वास्थ्य सुविधा देने का कोशिश और प्रयास हो रहा है। अस्पतालों में निश्चित रूप से विगत कुछ दिनों में अचानक से संख्या बढ़ी है और इसीलिए स्वास्थ्य सुविधाओं को बढ़ाने का लगातार प्रयास हम सब कर रहे हैं। कोई भी मौत होता है वो बहुत दुखद होता है, कष्ट होता है, चूँकि हर व्यक्ति की जान बचाने के लिए ही हम लोग काम कर रहे हैं, हमारे चिकित्सक सब काम कर रहे हैं और हमारे चिकित्सक या चिकित्सा कर्मी आप सब लोग देखते हैं आखिर दिन रात इस अस्पताल में भी लोगों की जान बचाने का काम कर रहे हैं। कोई भी घटना इस प्रकार की होती है तो मन को जरूर पीड़ा होता है।
And the big relief of the day came to students and parents of CBSE. After a meeting today, class 10th exams got cancelled and class 12th postponed at least till the 1st of June. That's when they will be deciding again on what to do. 15 days notice will be given, and so good sense actually prevailed on the CBSE board. But what about the other boards? Watch this report for more.
Amid the surge in India's COVID cases, the Central Board of Secondary Education Class 12 board exams have been postponed and the Class 10 exams have been cancelled. The exams were to begin on the 4th of May. The decision for Class 12 will be taken on the 1st of June and a 15-day notice will be given to students. Class 10 students will be promoted on the basis of an objective criteria, one that the board is still finalising. The announcement came shortly after Prime Minister Modi met the Union Education Minister Ramesh Pokhriyal and other senior officials.
अभी वर्तमान की जो स्थितियां जो रही हैं, हमारे देश के प्रधानमंत्री जी ने आज एक तत्काल प्रभाव से एक बहुत उच्च स्तरीय बैठक का आह्वान किया, क्योंकि हमारे लिए सबसे महत्वपूर्ण छात्र की सुरक्षा है।
Students, several state ministers and opposition parties have been demanding that the government cancel the boards.
It is definitely a relief because I also contracted COVID-19 a few days ago and it really made it difficult for me to study. Also, considering that there are lakhs of children involved in the board exams, I think we will be putting everybody at risk if the board happens.
Several states including Maharashtra, Punjab, Chhattisgarh have already postponed the state board exams. Delhi's Aam Aadmi Party government and the Congress's Priyanka Gandhi Vadra had pointed out how exam centres could turn into COVID hotspots.
हमें खुशी है कि एग्जाम 10वीं क्लास के कैंसिल किए जा रहे हैं और 12वीं क्लास की डेट्स रीशेड्यूल की जा रही हैं। हालांकि मेरा मानना है कि 12वीं क्लास के बच्चों के मन में जो एंग्जाइटी अभी बनी रहेगी रीशेड्यूलिंग की वजह से, वो भी दूर की जा सकती थी। उसकी जगह अगर उनके भी एग्जाम कैंसिल करके और एक कोई दूसरा तरीका निकाल लेते।
With a rapid rise in cases among younger population and no vaccine for those below 18, parents and students across India have welcomed the move. Rishika Barua, NDTV.
Let's talk about vaccinations now. Today was the last day of the Tika Utsav in the country, and the data available so far suggests that the average vaccination in the country has actually fallen despite the Tika Utsav. It came down from 35 lakh to 32 lakh. The Utsav, or the mass vaccination celebration, was meant to boost vaccination in the country. States set targets as well. But with this data available for the first 3 days, at least so far, it seems it has fallen short. Meanwhile, relief in sight for queues that have been coming up for the remdesivir, the drug that is said to be quite crucial in the treatment of COVID-19. After denying shortages, Centre has now stepped up the production of this drug, and fast-track approval has been given to 7 additional sites having the production capacity of 10 lakh vials. Moving on, the next story from the Kumbh, where numbers, deaths, COVID means nothing. Lakhs continue to be at the Kumbh and officials continue to play down that it is a super spreader event. This despite cases rising. There was a bit of a talk today that Kumbh might be cut short, but now there is news coming in that that will not happen.
No masks, no social distancing, no enforcement by officials, no fear among the devotees.
कुंभ जो चल रहा है तो किसी प्रकार का कोरोना का डर लोगों में नहीं, 1% डर नहीं है, कोई डर नहीं है। क्या कारण है कोरोना का डर नहीं? वैसे ही हुआ बना दिया है।
On Tuesday, COVID cases in Haridwar shot up by 50%. In all, 1,000 cases in just 2 days. But the top Mela officer in charge has downplayed the risk of the Kumbh becoming a Maha super spreader event. Calling the risk minimal and insisting that the need for a negative RT-PCR for each visitor will help contain cases.
I think you didn't hear me what I said in the beginning, that we are allowing people only after RT-PCR negative report. So the chances of any kind of spread are minimal. At the same time, people who are staying inside, we're regularly making COVID tests.
On the other hand, the police officer in charge admits the possibility that this could be a super spreader event.
क्या लगता नहीं है कि ऐसे में एक सुपर स्प्रेडर इवेंट बन सकता है, कि हर जगह यही बात करी जा रही है?
देखिए, जिस तरह का कोविड का जो एक सेकंड वेव आया है और सर्ज आया है, तो ऐसे में मैं इस बात से इनकार नहीं कर सकता हूं कि जहां भी भीड़ बढ़ेगी तो वहां संक्रमण बढ़ने की संभावना काफ़ी ज़्यादा रहेगी और उसमें चाहे वो भीड़ कम समय के लिए हो, ज़्यादा समय के लिए हो।
1 अप्रैल से ये नोटिफाई हुआ है और उसमें जो नोटिफिकेशन की अवधि है 1 से 30 तक है। मेरे पास ऐसी कोई जानकारी नहीं है अभी कि इसको कर्टेल किया जा रहा है और या फिर इसको आगे रद्द किया जा रहा है। ये ऐसा मेरे पास कोई भी किसी प्रकार का इंटीमेशन नहीं है।
Despite the rise in the number of COVID cases in Haridwar, it seems that the authorities still do not have a concrete plan to avoid Kumbh Mela from becoming a super spreader event in the near future. And it seems a negative RT-PCR report remains solution to every problem. With colleague Dinesh Mansera and camera person Ashok Mahale, I'm Akshay Dongre for NDTV.
India really has to be the only country in the world where such large congregations of lakhs of people is happening while we are still achieving new heights every day when it comes to the numbers. And talking about those heights, Mumbai, no alien to those numbers, and more than 90% of Mumbai's COVID cases are now coming in from buildings, and there are patients seeking beds all over. Private hospitals are full, pressure is now mounting on beds everywhere. But the cabinet minister there today made an important statement. Aslam Sheikh told NDTV that some celebrities are being admitted to big hospitals without serious symptoms, adding to the problem.
These pictures were from 2 months ago when Mumbai's COVID wards were almost empty. Now, getting beds is a battle. With most government facilities running on full, the pressure now is on private hospitals. According to the BMC dashboard, government institutions have 3201 normal beds, 1074 oxygen beds and 26 ICU beds and 9 ventilator beds that are vacant, while private hospitals have only 544 general beds, 323 oxygen beds, 19 ICU beds and 3 ventilator beds that are vacant. According to the dashboard, private hospital beds are 90% full and government hospitals are running at 76% capacity. Doctors say that affluent Mumbaikars are eyeing beds in big private hospitals. Dr. Gautam Bhanushali, who is in charge of the BMC's bed allotment policy for COVID patients, explains what's happening.
लोगों में थोड़ा पैनिक है, उनको लग रहा है कि केसेस बहुत आ रहे हैं तो शायद हो सकता है कि बाद में बेड मिले नहीं मिले, इसलिए प्राइवेट हॉस्पिटल पे लोड डेफिनेटली बेड का ज़्यादा है, डिमांड बहुत ज़्यादा है। हर व्यक्ति चाहता है कि बॉम्बे हॉस्पिटल भर्ती हुए, हिंदुजा में भर्ती हुए, लीलावती में हो, ब्रिज कैंडी में हो। लोगों को जो हमने एक वार्ड वॉर रूम बना रखे हैं जिसके नंबर हर जगह डिस्प्ले किए हुए हैं, नंबर व्हाट्सएप में भी है, होर्डिंग भी लगाया गया जिसके बारे में वार्ड वॉर रूम के तहत आना चाहिए।
Renowned pulmonologist Dr. Jalil Parker says Leelavati Hospital is creating beds by making more space.
गवर्नमेंट का भी दबाव है हॉस्पिटल पर कि हमने सबका इलाज देना चाहिए और हॉस्पिटल भी चाहती है कि इलाज दे, तो हॉस्पिटल जब चाहती है कि इलाज दे तो करेंगे क्या? तो हमने नहीं उनको कोई रेफ्यूज एरिया में रखा है, हमने लॉबी में रखा है, उनको बेड दिया है, उनको ऑक्सीजन मिल रहा है, उनको दवाइयाँ मिल रही हैं, नर्सिंग सपोर्ट है, अटेंडेंट सपोर्ट है।
Meanwhile, Maharashtra ministers are accusing some celebrities of being admitted to big hospitals without serious symptoms.
कुछ सेलिब्रिटीज हो गए, कुछ लोग हो गए, वो अपनी सोर्स लगा के एसिम्प्टोमेटिक है, उनको एडमिट होने की जरूरत नहीं है। चाहे वो अक्षय कुमार जी अपने आप को फिटनेस के फ्रीक कहते हैं, उनको जाना पड़ा, फिर सचिन तेंदुलकर जी चले गए और एक्टर्स लोग चले गए, ऐसे और भी लोग हैं, खाली उनका नाम नहीं लेता, लेकिन उनको वहां जाके एडमिट होने की जरूरत नहीं है, तो जो जरूरतमंद है उनको जगह नहीं मिल पाती है।
The ministers stopped short of naming the prominent Mumbaikars, but the allegation is serious at a time when the state is struggling in its response to the COVID surge. Can the state really afford to allot beds in private hospitals as a function of entitlement? With Pooja Bhardwaj in Mumbai, Saurabh Gupta, NDTV.
Let's get a live update on the show now. Let's go across to Purva Chitnis, my colleague, joining us from Mumbai. Purva, day one, what exactly is it looking like at the moment?
Well, right now I am in South Mumbai, and as you can see around, the shops are shut, roads are fairly empty. Yes, the lockdown style restrictions have kicked in from 8 p.m. but for the past 1 week or so, the shops were anyway not allowed to open. But the roads that you're seeing right now, one can only hope for the next 15 days. This is the kind of Mumbai that you will be seeing for the next 15 days, provided even people cooperate with the government on this 15-day lockdown style restriction. However, the Mumbai police has said that they will be enforcing this. The security is completely going to be beefed up, and any violators will be punished. So Mumbai police is also in action. They will be in fact looking at every vehicle, like how it was for the past few days. They were checking the vehicles, especially on the weekend lockdown. They were checking each and every vehicle if only essential service related persons should be traveling. And that kind of security the Mumbai police has promised that they will be enforcing this section 144, and people have to take it very seriously, otherwise the violators will be punished. So no unnecessary travel is permitted from now on for the next 15 days. And right now, like today in the morning, people were allowed to go out, so you can just see this traffic which is going back. But yes, from tomorrow onwards, even these many number of cars won't be there on the road.
Well, that is a sort of a mini lockdown of sorts that has been put in. But guess what? Another lockdown, or at least a curfew of sorts, being talked about in Rajasthan. Breaking news at this hour is that in Rajasthan, in all cities, from 6 p.m. to 6 a.m., there will now be a curfew. Harsha Kumari Singh joins us on the phone line for more. Harsha, we thought Rajasthan was actually comparatively doing better than the other states in the country, but there is a curfew now.
Yes, absolutely, because, Rajasthan was doing better than, the other states in terms of the number of cases being reported. But compared to its own record, it's been a very, very alarming rise. And actually, since the first week of March, when it was reporting about 1,000, 2,000 cases, now it's gone up to more than 6,000 cases. And Jaipur city itself has reported about 1,300 cases. So there's an alarming rise. The positivity rate has gone up to about 7.8%, even more, I think, by the time today's figures come in. And this will come into effect from the 16th of April. So there will be a curfew in all cities of Rajasthan from 6 p.m. to 6 a.m. Markets will have to shut by 5. Also, they've capped, they've allowed factories, etc. to operate, bus stands where people are coming and going. That's been allowed. Weddings, people can come and go, but again, the number is 50. So it is like a semi-lockdown. Of course, all gyms and theaters were already shut. I think there's also a cap on that, 50% of capacity. Restaurants will also have to close, but they can do takeaways. So clearly, they're kind of trying to look at the economy, but also trying to rein in the public. And I think that really is what seems to be the guidelines that have been issued, seem to keep in mind the fact that, they don't want to upset businesses, but at the same time, they want to keep people indoors as much as possible. So that seems to be the overall picture, that they're definitely becoming stricter because the number of cases in Rajasthan is also going up alarmingly.
All right, so after Maharashtra, more curbs coming in for Rajasthan, more curbs coming in for Delhi as well, as we are all looking at constantly escalating figures in the country. Those two gentlemen on your screen, the present Chief Minister of UP and the former Chief Minister of UP, political rivals, but both COVID positive, coming in on the same day. Remember, the Chief Minister of UP, Adityanath, had actually quarantined himself after at least 3 of his staff members had tested positive.
उत्तर प्रदेश में जो अभी कोरोना के वजह से जो परिस्थितियां बन रही हैं वो बहुत ही ज्यादा खराब हैं। कुछ तो शॉकिंग चीजें हैं, जैसे प्राइवेट लैब्स को अभी भी टेस्टिंग की इजाजत नहीं है। तो मतलब इन परिस्थितियों में भी कहीं आप जाकर और हॉस्पिटल के एडमिशन के लिए आपको सीएमओ से लेटर चाहिए, तो इस तरह की अजीब अजीब चीजें जो सरकार जिस तरह के रूल्स बना रही है, जिससे लोगों पर और भी एक्चुअली दुगना आक्रमण है।